Welcome back to Champions of Care, brought to you by Oakwood Healthcare. Today we're talking about how to have a healthy pregnancy, and our purpose is to arm you and the women you love with information they need to have a healthy pregnancy. With me in the studio today is Dr. Shari Maxwell.
Hi.
Dr. Maxwell is an obstetrician practicing for Oakwood Healthcare in Dearborn, is that right?
Dearborn and Canton.
Canton, I'm sorry, Canton. So, Dr. Maxwell, when that pregnancy test comes back positive, what's the first thing a woman should do to have a healthy pregnancy?
Well, I think the first thing that she should do is to make an appointment with her physician.
The prenatal visits.
The initial prenatal visit, or what we call the intake visit. In some offices, they will initially have the patient meet with the nursing staff, at which point a lot of blood work will be drawn. Or in some offices, the initial visit will be with the physician. I preferably have them meet with my nursing staff first, and then they draw a lot of blood on the patient, and then the next visit is with me.
Well, that sounds scary. They draw a lot of blood.
Well, we have to draw certain laboratories to ensure that the pregnancy is healthy. So, labs that we may draw is blood count, a complete blood count, to assess the patient for anemia. We'll also look at the patient's platelet count to make sure that there are no clotting disorders. Other things we'll look at is a patient's blood type to check to see if there are any antibodies against the blood. We'll also look at the patient's HIV status, hepatitis status. We'll check to see if they've been previously immunized with rubella or varicella. We'll also check their urine to make sure that there is no infection. So there are certain laboratories that we need to draw at the very beginning of the pregnancy that'll give us some insight as to how healthy the patient is.
Wow, this program's all about having a healthy pregnancy and a healthy baby and keeping mom healthy. Now, when should that first visit be? If someone has bought the little test kit at the Oakwood pharmacy or at the drugstore, when do they come see you?
Well, at that time when they've documented that they have a positive pregnancy test, I would encourage the patient to call the physician's office at that time.
Right away.
Right away.
And how many prenatal visits are there?
Oh, we see the patients a lot during the pregnancy. Initially, for the first 28 weeks, well, for the first 28 weeks, yes, I'll see the patient once a month. At the 7-month time period, at that point, I'll see the patient every 2 to 3 weeks until the patient is about 35 or 36 weeks, at which point I'll see the patient weekly thereafter. Of course, the appointment schedules may vary if there are some concerns or if I need to see the patient more frequently.
Or if the baby comes early.
Or if the baby comes early.
Now, during this pregnancy time, what is your advice for women about diet, nutrition, sleep?
Well, in terms of diet, a lot of patients may see pregnancy as an opportunity to overeat. I try to discourage against that. I try to encourage my patients to eat healthy and to be sensible about it, to choose from the appropriate food groups. Of course, your milk products, your meat, your vegetables, your carbohydrates. I try to ask them to avoid fast foods as much as they can, fried foods, to eat more lean meats, fish, chicken, lean steak or beef. In terms of
cravings, what about cravings?
Well, lots of patients do have cravings, and I don't beat up on them about that. I let them have them if they are desiring them, but of course, as long as it's something safe, and if they don't do it in excess. Those are the things that I'm most concerned about.
Now, we have a question here about C-sections. Are C-sections optional? You know, I know some women say, knock me out and get that baby out. What about C-sections?
Well, generally speaking, we try to always push for a vaginal delivery. Certainly if a C-section is indicated during labor, we will proceed with one. If a patient comes into my office requesting a C-section, then I certainly have to look at the reasons why. Does she have a history of a previous cesarean section? if she does, then I try to look at the reasons why that surgery was performed initially. And then that will help me make decisions regarding the delivery and what type of delivery we should have or push for. In terms of vaginal birth after cesarean section, over 85% of patients will deliver naturally if allowed a trial of labor. So I really do want to encourage the patient to deliver naturally if she can.
Now, one of your colleagues, Dr. Craig Glines from Oakwood South Shore Hospital, has prepared some deeper information about C-sections. Let's take a look at that right now.
An elective cesarean section would be where the patient and the physician agree on a plan of action, and that would be where the patient comes in and they have a C-section that's predetermined date, and it could be because they've had a previous cesarean section. But one of the newer trends is for people to have primary elective C-sections. And this is not as common, but it is picking up some steam across the country. The problem involves more of the timing of it than just the actual action of it. And previously, there was a lot of them that were done under 39 weeks gestation, and all the studies showed and all the practical outcomes showed that these babies were having trouble with either wet lungs, respiratory distress, other types of problems. And so what Oakwood has done is, through the OB safety team, is we virtually eliminated every elective induction and every elective C-section under 39 weeks. And that has reduced our NICU admissions for those types of deliveries from around 4 or 5% down to almost 0%. I think the other interesting thing is that CMS, the Centers for Medicaid and Medicare Studies, they are endorsing no elective C-sections under 39 weeks, and a lot of the other stuff that the OB safety team is looking at. And in the future, reimbursement is going to be based on following these guidelines. So it's another way that Oakwood is ahead of the curve from our competitors in the southeastern Michigan area.
Dr. Maxwell, clearly it's not a good idea for a woman to make the decision to have a C-section. But what are the decisions a woman can make and should make about the birth of her child?
Well, you know what? I try to counsel my patients to try to be open-minded. I tell them the options regarding pain management in labor. I reassure them that everything that I offer them is safe for them and the baby. I also encourage my patients to have their family members involved, particularly their spouse or their significant other. Certainly that support will help make the laboring process simpler. I encourage my patients to do the birthing classes so that they will have some expectation as to what to expect once they arrive on labor and delivery. Our labor and delivery is a very safe place. Our nurses are kind, they're warm. We try to provide a comfortable environment so that the patient can have a good experience during the labor and delivery process.
And with important information like this, they'll be more knowledgeable when they get pregnant and even before they get pregnant. Dr. Shari Maxwell, you practice in Canton. You're an obstetrician. If people want to know more about you and can reach you directly, they'll find your phone number on oakwood.org, or they can call 1-800-543-WELL. I'm so grateful you were able to come here today and talk to us.
Thank you for having me.
There are times when, even if you do everything right, a woman may still have what's considered a high-risk pregnancy. When we return, we'll be talking about high-risk pregnancies and how to make sure both mommy and baby are just fine.